We begin this program with robotic surgery and how physicians use this approach to enhance their ability to do laparoscopic procedures that greatly reduce the size of an incision and thus reduce recovery time as well. Here to explain this new surgery is Dr. Ashok Kar of St. Joseph Hospital in Orange.
Robotics would enhance our ability as surgeons to do procedures that we have always done, but the advantage of the robot is now we're able to use laparoscopic skills to reduce the size of the incisions and therefore make the procedures more accurate and easier for the patients. The robot does not do anything that is not under the direct control of the surgeon. The robot is an extension of the surgeon's arms and is capable of doing all the motions that the surgeon is capable of doing. It's just that the robotic arms are very small, and so they can go into the patient and do exactly what the surgeon wants the robotic arms to do. The benefit to the doctor is that the doctor is seated at a console in an ergonomically good position, and so he's not bent over, crouched over the patient, and so the amount of surgeon fatigue is less. Also, the structures are displayed on a screen that has three-dimensional view, and it also enhances the picture so that we can have magnification and look at the structures inside the abdomen with good amount of magnification. And also, one of the advantages of the robot is that they have what is known as scaling, and so even if the surgeon has a slight tremor, it is not transmitted to the patient. The benefit to the patient is tremendous because we're using small incisions. As a result of that, the recovery is much faster, and we're able to do these major procedures using these small laparoscopic incisions. In the old days, we did open surgery, and the advantage of the open surgery was that you could put your hand inside the abdomen to get structures from inside. But the disadvantage was larger incisions, which meant more pain and longer recovery for the patients. I just did a robotic procedure 2 days ago, which took 2 hours and 45 minutes, which is about the same time as it takes to do an open radical prostatectomy. The advantage was that the patient went home 1 day after surgery, and I saw him in the office today, and he's well on his way to recovery. St. Joseph's Hospital here in Orange, California is the first community hospital in all of Southern California that has got the robot, and this has been achieved by philanthropic support from the Gunther Foundation as well as our grateful patients. So we are the first community-based hospital in all of Southern California to have got the robot and have started utilizing it. It takes a very, very dedicated team to be able to learn to use the robot. Any experienced surgeon who is willing to commit the time and the effort to do robotic surgery would be able to do it. The future of robotics is mind-blowing. Right now, the robot has been FDA approved for several urological procedures as well as for several heart procedures. At the present time, in urology, we're using it for radical prostatectomies, but in the future, we're also going to be using it for several kidney surgeries, including partial nephrectomies, and also reconstructive surgery for the kidneys. The heart teams here at St. Joseph's Hospital have also started doing minimally invasive heart surgery, whereby they can take down the internal mammary artery using robotic assistance, and therefore the surgery is achieved with small incisions. The gynecologists at our hospital have also started using robotic surgery, and we also have an active bariatric surgery program which is for obesity, and they've received the training and will be starting to use the robotic procedures in the armamentarium in the near future.